Okay. We have another new patient. And the spine is divided into basically a house of 3 floors. You've got the foundations of sacrum, you got the first floor lumbar, second floor, which is the thoracics, and then the next cervical, which is the top floor, the third floor, and then you have the roof, which is the occiput. Okay? So we always start at the foundation. We want to rebuild a home. What do? We start with the foundation. So he's got sacral base posterior, left internal. Okay? So he's got some postural distortion in his lower back. I make a mental note of that. Now that I start to assess, palpate, check the spinous processes going back left and right, see which one's stuck, check for muscle spasm, and I'm looking for primary misalignments, also known as subluxations. So at T12, he's got, is that tender?
Yeah.
Okay, T12 tender. He's also got muscle spasm guarding on the paravertebral muscles. This is normal due to misalignments. Tender right here?
Yeah.
Okay. T9 is also subluxated to the right, tender, and muscle spasm. This particular nerve goes to the adrenal gland. So if you're misaligned here, tendency is to be fatigued. Tender here?
No.
No. Okay, now we're getting close to the trend. How about right here? Even though he says no, T1 is misaligned to the right, this nerve goes to the heart. So I make a mental note that that's where we're going to start. Tender? No.
No.
How about right here?
Yeah.
Okay, so C1 or C2 on the right is misaligned. C5 on the left, T1, 1, 2, 3, T9, T12, that's 5, 6 misalignments altogether. So what we're going to do to begin with, we're going to start the correctional process now. The assessment's been completed. I made a mental note as to where the primary subluxations are. Therefore, we're going to starting with T1 left to right. So this is a scissors move. Pisiform contact on top of T1. Traction opposite, in this case it's to the right, or right to left, I beg your pardon. Then I take his head to end plane, speed, straight across lateral. You get a nice audible, nice release. Yes? Okay. All right, now I come back down to the foundation. You go sacral base posterior left in this case, I grab a pelvis, the patient's comfortable during the lying down on the side process. So I'm going to ask the patient first, please lie face side to me, right side down, left side up. Okay? Now, come closer towards me. That's good. Make sure the patient's comfortable. Always have the patient facing away. Get them in the proper position. Why? Because you want to be specific. This is not general. Specific. We're looking for specifics so we can deliver the goods the proper way. Now, in this case, the sacral base posterior left internal. My contact S2. And what I'm going to do is I'm going to do a traction clockwise. Go from posterior to anterior. And I'm going to go from superior to inferior. Just like this. Watch. Nice release. Opposite side. This is to complete the pelvic area. Now, once again, we do the same thing opposite way, make sure the patient's comfortable. Okay? We get them in position so it's very specific. Wallet out of your back pocket, please. Over here. Right now. You're welcome. We contact ischial tuberosity. In this case, I'm going to have him loose. Okay? I make an assessment and I see that by having his leg this way around his foot inside of his knee, it's going to open this area much better and I'll be able to get a very specific adjustment on this area. Therefore, contact ischial tuberosity, traction down the leg, and it's going to be a straight adjustment towards his hip. Just like that. Okay, now I noted anteriorities in this thoracic spine. So this time I ask the patient, please sit up, face me. Sit up, face me. We remove the pillow. Get the patient in proper position to be able to adjust the anteriorities. More? That's perfect right there. Legs up. Always make sure the patient's comfortable. Pause. Make sure the patient's comfortable. Make a connection with the patient. Okay? Palpate down, find the misalignment. There it is. Ask the patient to breathe out. You traction below the vertebra, up towards the vertebra. Ask the patient to breathe out, Sasciolo. And straight anterior to period. Just like that. You had one more T5. Breathe out. Okay, good. Ask the patient to get properly placed. Place your head here. Place your hands on your stomach. Knees extended. Okay, this is the last part of the adjustment. This is the third floor. Undo. Undo your butt. Okay? Please close your eyes. Please close your eyes. Okay? Now, this is a very delicate part of the patient, their neck, because it's close to the brain. So you always want to come in slowly. Take your time palpating. Start at C7. You always repalpate. Make mental notes. Okay, I know it's C5 on the left is out of alignment. So I'm going to go to C5, lamina contact, tissue slack, lateral bend, straight lateral shot. Always speed. C2 on the right. Nice adjustment. Okay, assess, take your time, adjust, and let the power that made the body heal the body. Okay, go ahead and walk. Stay. Yeah. We're going to do another interview shortly, so could you wait, please? Thank you. All right, sir, how do you feel?
Yeah, feeling good.
Okay, so what I'd like you guys to do is please be seated.
मैं आज इस क्लिनिक पे आया, मुझे पेन था इस टांग में पिछले 4 साल से। I came here. Now I am feeling better.
Okay, anything else you'd like to say?
No thanks.
Okay, so as you can see, 2 men, same condition, 4 or 5 years, just after one chiropractic adjustment, they're feeling better. Chiropractic works. Why? Because what we do is we remove the interference by finding the misalignments and by hand only adjusting so we can get clear communication from brain, spinal cord, nerve, and out to the rest of the systems, giving the body function, which means health. We hope to see you soon. Thank you.
Okay. Okay.
Okay, be seated.